Yesterday, Prime Minister Morrison suggested that advice from ATAGI had slowed the vaccine rollout, indicating that ATAGI was now making decisions normally reserved for government ministers. Is the government actually running the vaccine rollout? Is the government taking responsibility for the vaccine rollout results? Or is it being left to the faceless men and women of ATAGI?
From beautiful Echuca, very noisy Echuca as well, Marylouise McLaws, we'll start with you. What did the Prime Minister do and say in relation to ATAGI? What did it mean to you?
Well, ATAGI gave the right decision that those under 60 need to understand that the data on adverse events hasn't changed. Then the federal government wants people to use the AstraZeneca because we don't have enough Pfizer. And so I think there's a bit of shifting of blame towards ATAGI, where in fact ATAGI is basically saying the data hasn't changed and that really anybody who's already had a Pfizer, yes, go and get another one, but really we should be using Pfizer in the young ones. And I just remind you that the AstraZeneca uptake has slowed down for dose 1 for people 60 to 69. So they're the group that really, for some reason, have got a bit confused about having AstraZeneca because the 70 and over have had dose 1 and 2. So I think that all of this has caused a great deal of confusion in the community.
There's been many changes of advice from ATAGI, Mukesh.
Yeah.
And of course, the issue of indemnifying GPs like you in giving the AstraZeneca to a slightly younger cohort has been a live one.
Look, we have been advising on this since January. We knew the vaccines were going to come. We needed to be ready for this. We had a whole lot of things that we've talked to government to say, these are things you need to do. One of which was actually to say there should be some indemnity in the situation, especially if there were going to be mishaps.
But you've got it now, haven't you?
Well, no. So it's been promised. It's been an announcement.
Right.
But nothing's come through.
Okay.
And what Marylouise is saying is absolutely right. The advice hasn't changed. And advice is changed, and we need to stick with the medical advice, and this is what it is. Yes, there is opportunities for people who are not 60 to get the vaccine, but you always had to get that conversation, and the Prime Minister was right, with your doctor, and then make sure that you do that. But we're getting people in their 18s and 20s and 25 saying, I want that vaccine. And that's not a reasonable thing to be doing. And
so you wouldn't vaccinate someone?
No, I won't. In my practice, I won't vaccinate anybody under 60
with AstraZeneca.
With AstraZeneca until I see that policy in place. I would then do it with that conversation. Not expecting.
Can I jump in there? So the indemnification is one thing, which sort of protects you legally. Then, should there be a suit that arises from an adverse effect? But what about the medical concern itself about vaccinating someone that young with AstraZeneca? Do you have that concern?
Yes, I would. So I'd be really concerned about somebody who's even under 40. And again,
a whole lot of people I know in their 20s, when the Prime Minister said that the other week, said, you know, go and talk to your GP. A whole bunch of people I know went and got AstraZeneca straight away. Yep. They're fine, they're good, which is great to hear, and they had no hesitation doing it. Well,
we had a lot of people at the very beginning. We started vaccinating 22nd of March, and none of the people, touch wood, we've have had any problems. And we know it's a very small number of people that are going to get problems. And the other thing we have learned is that we know what to watch out for. And if you know what to watch out for, you get in early, you can do something about it. But we actually need to use the Pfizer for the people under 60 at the moment. If we do go down to 55 or 50, as we were doing with the previous lockdown, there needs to be that conversation. There is a risk. It's not a big risk, but there is a risk. And people who may have a misadventure should be looked after by government if there's an issue. It's their program. They've bought it. They've sponsored it. They've said they're going to pay for it with a no-fault compensation.
Well, let's see if indemnification comes through.
Please give us that.
Meshel, can I just ask, sorry, I'll just jump in there. Meshel, did you get vaccinated?
I've had my first Pfizer shot, but it was really hard to find. I did everything they told me to do. I went on the website, I went to my GP, he didn't have it, he didn't know what to do. He said, go to the website. I went to the website, I got an appointment that was ages away, but I found out, I had my ear to the ground, and I found out that I could get a shot at the Commission Flats near my house. So I went down there.
Williamstown?
Hey?
Are you in Williamstown?
Yes. How did you know? Yes.
My local area, I know about it.
I didn't recognise you with your mask.
So hang on, were you allowed to do that?
Yeah. So I went down there with my Medicare card and I got my shot and a free coffee.
Were you taking a Pfizer vaccine, though, from someone from the Commission for who was supposed to get it?
No.
Okay.
Are you joking?
Just checking.
No, they're pretty rough flats.
They were throwing eggs down from there.
Not at me, they're not.
No, they're throwing eggs at people down from there.
No, not at me, they're not. I've got heaps of friends there.
So how did you manage to work the system?
I don't know. I think that's the way the system works.
They didn't have enough arms to put vaccines in, and if you don't use it within 6 hours, you lose the vaccine.
Yeah.
Right,
So it's better in an arm.
There are places they don't advertise it, Steve.
No, Steve,
but I can take you if you want to go. I'll protect you.
No, I'm right. I've had my 2 AstraZeneca. I'm fine.
Cool.
But I know people in Sydney. I know a guy who's a fireman and his wife who's a sports physio, and they can't get Pfizer. They've tried to book, and it's 2 weeks, 3 weeks down the track. And they're frontline people dealing with people, and they can't get Pfizer. I mean, but AstraZeneca, didn't that save the UK? I mean,
Absolutely.
It did.
So why are you so against?
No, I'm not against it. But, you know, for me, the worry was in the UK, their cut-off was 30, and they did very well. But then when they dropped the rate of infection, because they did so well with the vaccination, the community rates increased. So they actually increased it. Marylouise, you can sort of come in on this if you like. You know, that they went up to 40 because of that ambient spread. And I think that's the problem we have to recover.
The non-medical people here, though, are going, well, if it saved the UK, why can't it save us? If we got so much of it, we make 1 million doses a week.
Marylouise.
Well, I was just going to say, Steve, that one of the issues is that Delta now has taken over. And AstraZeneca is fine for saving people from death and hospitalisation. But the group that you want to save from transmitting it, acquiring it and transmitting it, are the younger ones, the 20 to 39-year-olds. And they need Pfizer because it's got a better response to Delta. And you can give them the second shot faster. Now, sure, AstraZeneca is great. I've had my AstraZenecas and I'm probably not going to die or get severe illness. But because of my age, I don't see as many people as young people do. They've got a very large social network. And that's where you want to cut the cycle of acquisition and transmission. And that's why I'm more supportive of Pfizer for the young ones.
Oh, well, Alison, you're sitting here and you can't get anything, right?
Well, no. And also young people they form the largest portion of the workforce that moves around a lot, right?
Yeah.
And we pay also taxes and keeps the healthcare system going.
We'll get to you eventually. Stop fussing.
Gotta raise the flag, you know. So I watched the Q&A program last week or the week before, and there was a really great question from a bloke called Tristan, and he asked, and I think he represented a lot of young people as well as I did, which was just, what can I do to make this better? I'll take a risk if it's going to ensure that we, as a policy, can collectively move out of these lockdowns and these problems, we can move into the horizon. And the response from the experts on the panel was that on a health front, there are more risks to you of taking AstraZeneca, and it's better that you wait for Pfizer. And then on a policy front, you going out and taking that vaccine isn't going to change the timelines.
Would you take AstraZeneca?
As soon as Morrison did that presser, I was one of those people on every place I could go looking for it. And then I watched the program, and I also I've followed ATAGI's advice. I'm also the daughter of a registered nurse, and I respect the public healthcare system. And in a time of Trumpian attacks on all of our important institutions, I'm just going to follow that advice. And there's also research I know that's come out today that shows that is reinforced by research that shows that young people are more at risk of blood clots than they would. But if I have COVID on if I was in Sydney, I would be getting AstraZeneca.
Steve, just before we move on, I just wanted to ask you, I'll come back to you, Marylouise, but I just wanted to ask you, what was your read on Kevin Rudd's intervention into trying to get us some Pfizer earlier?
He's just had a bit of attention deficit syndrome, Kevin. He likes to stick his hand. I don't know how that letter would have ever got into the hands of the ABC.
I have no idea.
Couldn't imagine.
Absolutely no idea.
We had Malcolm Turnbull on the project to talk about that, and Malcolm and Kevin are now best buddies. Don't remember them being so friendly when Kevin was trying to become the UN Secretary-General.
Attention deprivation does that to former Prime Ministers, I suspect. Marylouise, you wanted to just jump in there?
Yes, I was just going to say that there's evidence that AstraZeneca works very well, or Pfizer. And that was from the UK when they were looking at the impact from vaccinating young people from December to the end of March. Problem is that was with Alpha, and now there's Delta. Delta's twice as infectious. And we do know from Qatar and from other areas that AstraZeneca seems to have at least a 20 percentage point lower vaccine efficacy, even with that second dose for symptomatic infection. And in people like Alison and Meshel, they are young enough to be able to transmit it. And we want them to have a great immune response so that they don't get symptomatic infection, and therefore their viral load is lower, and that they're less likely to keep spreading it in the community.
Do you think it's possible
Meshel is taking the age discount, I've noticed. I've got to move on, Meshel, so just quickly.
Ask if it's possible that we in Australia have become blasé about actually getting COVID. Like, we're so worried about AstraZeneca. Like, I just don't want COVID. I think I would take, honestly...
Well, hence the change in the ATAGI advice, which is if you have COVID, even this variant at large, go and get whatever vaccine is available to you.
I don't want anyone I love to get COVID, you know?
Very, very quickly, Marylouise.
Yeah, that'll be fine if our government offers a booster of messenger RNA vaccine for your third one, and then that will increase your immune response.